After passage of the Affordable Care Act in 2010, healthcare has remained a major political issue in the United States. It was a major issue in the 2018 congressional elections, and it's a major issue in the 2020 campaign already. Although 22 million people gained health coverage under the Affordable Care Act, millions of Americans remain uninsured. And affordability is still a huge problem for many families with the growth in high deductible plans. And add to that the fact that the Trump administration has tried to undermine the law in various ways. First, through the tax reform law of 2017, it removed the individual mandate, meaning people didn't have to buy insurance. Second, it canceled the cost-sharing subsidies that increased premiums. And third, it reduced the open enrollment period and cut funding for navigators and advertising to get more people into the exchanges. These changes both increased premiums and lowered the number of Americans who had health coverage. They made a lot of Americans uncertain about their coverage. To ensure coverage and prevent erosion of benefits like the guarantee of coverage for Americans with pre-existing conditions, a number of people have begun to demand a simpler system with a more solid safety net. And to get that, they're looking to Medicare. And Medicare has an appeal as a simple system, which is a solid safety net that people can trust. The consequence is Medicare for all is a very persuasive political piece of rhetoric. But what is Medicare for all? Well, that depends a lot on who you ask. There's a wide spectrum of competing plans that might actually qualify as Medicare for all. They range from a single-payer plan with no real role for private insurance at one end, the most radical end, to Medicare or Medicaid buy-in on the other end, a pretty simple, limited plan. And then there's one plan in the middle that offers a more moderate approach of reducing the options to regular Medicare, Medicare Advantage, and employer-sponsored insurance. Well, the first plan to be called Medicare for All was introduced by Senator Bernie Sanders as the Medicare for All Act of 2017. It will replace all private health insurance completely with a single-payer system that expands the current Medicare program in the United States to all residents. And it would be phased in over the course of just 4 years. In year one, all children up to age of 18 and adults over the age of 55 would become eligible for Medicare. By year two, the eligibility age at the top end would drop to 45 years of age. In year three, it would be 35 years of age. And by year four, all residents in the United States would become eligible for Medicare for all. And the program would automatically enroll everyone who was eligible. This would get the United States very close to 100% health care coverage. Under Bernie Sanders' plan, there would be no out-of-pocket costs, no premiums, no deductibles, and no copays. The bill does allow for cost sharing for drugs up to $200 per year in order to encourage people to use generics and therefore to have development of generic drugs. Payments to doctors, hospitals, and other healthcare providers like home healthcare agencies or hospices would be set by the government in a specified fee schedule. Senator Sanders' bill would also increase what services Medicare covers. Of course, the traditional hospital services, including inpatient services, services at outpatient hospital facilities, the emergency room, and other items would traditionally be covered under Part A. Ambulatory patient services, like going to your primary care doctor's office or going to a specialist's office, would also be covered under Part B. And prescription drugs and devices would be covered under Part D. But many other services would also be covered. Mental health and substance abuse treatment, lab and diagnostic services, reproductive maternity care and newborn care, pediatrics. Importantly, there'd be an expansion of dentistry, eye care, and hearing care that are not traditionally under Medicare would now be part of the Medicare benefits package. How much would all of Bernie Sanders' Medicare for All plan cost? Well, the conservative Mercatus Center at George Mason University estimates that the plan would add $32.6 trillion to the federal budget over 10 years. Is this an astronomical amount of money? Well, remember, we spend about $3.5 trillion on healthcare per year today. But mainly, the Medicare for All plan by Senator Sanders shifts the cost from private employer-sponsored insurance to the government. In fact, over the same 10-year period, the total national health expenditures of the Bernie Sanders plan would actually be about $2 trillion less than what the American system is probably going to pay over that same 10 years. So the senator's plan would actually be less than our current spending. Now, the Mercatus Center is skeptical that Senator Sanders' plan could be passed, largely because they think hospitals and doctors will oppose the decrease in their payments. Senator Sanders does not really define how his Medicare for All plan would be paid for. He does suggest several options for funding the expanded government program. These options include a 7.5% payroll tax, income-based, paid for by employers, a 4% income-based tax on households, an increase of taxes on households with income over $250,000, additional capital gains taxes and estate taxes, and a wealth tax. Suffice it to say, he puts everything in the basket but doesn't tell you exactly how much money he's going to get from each of those taxes and whether they'd cover the entire $32.6 trillion. Now, this is the most radical plan out there, and it's likely it would shift the United States to a single-payer plan, although that wouldn't be socialized medicine because doctors, hospitals, and many other providers would still be private. But it does face problems on two scores. One is, while the public is generally very supportive of Medicare for All, once they learn that this Medicare for All plan would require that they give up their private insurance and they pay more taxes, support drops. According to the Kaiser Family Foundation, just about 56% of Americans support Medicare for All, but when they find that additional information about paying more taxes and giving up their insurance, support drops to under 40%. It's very hard to go to Congress with a big radical reform and start out with less than 40% of the population supporting your plan. In addition, much like the Clinton healthcare reform, Senator Sanders' plan will face formidable opposition from the private health insurance companies, since the plan would actually eliminate them, leave them a very small amount of option to offer plans that complement Medicare for All. These private insurers would oppose Medicare for All with everything they have and would try to torpedo it. So that's the Bernie Sanders version of Medicare for All. At the other end of the spectrum is Medicare buy-in. Medicare buy-in, for those currently proposing it, is not really a Medicare for All plan. Rather, this plan would lower the Medicare eligibility age to 50 or 55, while also offering people who buy their insurance on the exchanges or individually the opportunity to buy in to Medicare. This is being proposed as a new idea, but in reality, it's just the public option that was initially part of the Affordable Care Act, but got removed to get the bill passed in 2010. In other words, Medicare would be one option on the insurance exchanges with premiums, deductibles, and copays, but it would be available in every county in the country. A middle ground, a middle Medicare for All plan is one that was developed by the Center for American Progress, a progressive think tank in Washington, D.C. This middle Medicare for All plan has been dubbed Medicare for America, and it's been introduced as a bill by Congresswoman Rosa DeLauro from Connecticut and Congresswoman Jan Schakowsky from Illinois. This plan would create a new program called Medicare Extra. All American citizens would be eligible for Medicare Extra. Americans could opt to temporarily stay in their existing plan, whether that's old Medicare, Medicaid, or employer-sponsored insurance, but over time they would migrate. Medicare Extra would cover essentially the same generous benefits as the Sanders plan, but it would require income-linked premiums, deductibles, and copays. If an American's income is below 150% of the federal poverty line, and for a family of four, that's about $37,500, they would pay no premium. Between 150% of the poverty line and 500% of the poverty line, that's between $37,500 for a family of four and $125,000 for a family of four. Premiums would range from 0% to 10% of income. And for families with incomes over 500% of the federal poverty line, premiums would be capped at 10% of income. Out-of-pocket costs also would be income-linked. Below 150% of the federal poverty line, people would have no copays and no deductibles. Above 150% of the poverty line, deductibles would scale up to 20% of the total cost. This plan would be financed by taxes on high-income individuals, including a surtax on capital gains income, and additional excise taxes on cigarettes and soft drinks. Now, payment to doctors and hospitals and others in the Medicare for America plan would be set on a fee schedule, and that fee schedule would rise from the current Medicare rate to something between Medicare and the higher rates paid for by private insurance companies. Rates for primary care would increase higher because they want to encourage primary care doctors and primary care visits. Now, the Medicare for America plan would create direct negotiation of drug prices, and this would cause a drop in the spending on prescription drugs. And private insurance companies would also have an important role. First, they can continue to provide private insurance through employer-sponsored insurance. Second, they would continue to provide Medicare Advantage plans so that people who are in Medicare could choose between traditional Medicare or the Medicare Advantage managed care plans. So private insurers would actually have a role. They would not be put out of business like in the Bernie Sanders plan. Employers can sponsor their own coverage, employer-sponsored insurance, but it must have an actuarial value of at least 80%, and employers must pay at least 70% of the premium. Workers who don't like their employer plan could also buy into Medicare Extra by contributing 70% of the Medicare Extra premium. If employers don't want to directly sponsor private insurance for their workers, they can make payments to Medicare Extra for their workers to come in. Finally, they can make aggregate payments in lieu of premium contributions, about 8% of total payroll. Small employers are exempt from making payments. They can choose between offering no coverage, offering coverage subject to the Affordable Care Act rules, or getting Medicare Extra for their employees. Unlike Bernie Sanders' plan, Medicare for America is phased in over a longer time period, 8 years. In the first year, Medicare Extra is established and offered as a public option for counties without an insurance in the individual market. By year 5, the uninsured, newborns, and people turning 65 start to be auto-enrolled into Medicare Extra. In year 6, Medicaid and CHIP beneficiaries are folded into Medicare Extra. And finally, by year 8, large employers get the option to sponsor Medicare Extra for their employees or retain their employer-sponsored plan. So we have 3 plans under the rubric of Medicare for All. One is the Bernie Sanders single-payer plan. At the other end of the spectrum is a Medicare buy-in for people 50 or 55 years and older. And in the middle is Medicare for America that retains traditional Medicare, Medicare Advantage, and employer-sponsored insurance, but rolls Medicaid, CHIP, and people in the exchanges into Medicare. Americans are starting to believe in the advantage of simplicity of Medicare, and they prefer to have something that is solid, they know will be a safety net if something untoward happens to their insurance. This is one of the reasons the debate has shifted away from exchanges and Medicaid expansion to the Medicare for All rubric. This issue and how much traction it gets is something we will see through the 2020 election, but probably some reform will happen early in the next decade because security of health insurance is something the American public really cares about, and they're nervous about it now with efforts to dismantle the Affordable Care Act.